Well, the answer could probably be your mental health. Hello, I'm Richa, interning under Dr. Shiba Singh at her mental health studio called TalkSpace. While observing October as the Mental Health Month, we are trying to raise awareness around mental health with the theme Making Mental Health and Well-Being for All a Global Priority. Today, we have with us one of the leading family physicians in Powai, Dr. Gaurang Desai, to answer all your questions around physical and mental health. Dr. Desai practices as a family physician since 1998. He holds an MBBS degree and is attached to Veeranandani Hospital, Mumbai as a consultant family physician. He also works as a medical advisor for corporates. Thank you for joining us, sir. We're privileged to have you here with us. We welcome you to the show.
Good evening, sir. We welcome you to the show. So let's just dive right in to the questions. Okay. So my first question is that do you believe that sometimes people who come to you with somatic issues have a psychological basis to it?
Yes, many do, and many will end up with a family physician first with multiple somatic complaints. As we all know, it's called psychosomatic complaints. Listening to the patient for the longer time will actually tell you more, because there will be multiple complaints over a period of time, more than 3-4 places, aches and pains, and which you will not be able to figure out as a one particular disease explaining it, but you will realize that there is a possible psychological element as one talks, and also by looking at the patient too. But best thing is to just allow the patient to come out with the history, and very often you will find that. And yes, I do definitely believe it is.
Right, so you rightly mentioned that how building a rapport could bring out the true history of the patient, which helps us find that other than the medical issues.
Yes, very careful to not trivialize them, and not to, even if you're sure these are psychological, you don't have to dismiss them, these are psychological, probably hear them out, and over a period of time convince them that there is nothing more to it than.
So ruling out the medical reasons first.
Of course, deficiencies, endocrine issues, any other disease brewing. When you know that the symptoms have been going on for months and years, automatically you rule out many things which it would have manifested in some other way.
Okay, so like you mentioned, aches and pains. So have you seen patients coming in with different shifting pains all over the body, but absolutely no medical reason for it? And if yes, how do you deal with it?
I think the same way. I would just see if the pains are really mechanical, if there is a basis for the pain. Duration is very important. For how long. In fact, going back even into the teens, whether it has been there, getting the sleep history, whether the person is sleeping well. If you ask me, one of the major causes of aches and pain, especially in the lower limbs, in a woman, I would most definitely look for iron deficiency anemia, rather than just focusing on vitamin D and B12 and other things. Because that's one thing which may present in a odd way, and just do an iron study. I think that is something which I am using a lot these days. And if you find that no, there is no basis, and looking like fibromyalgia or other stress-related issues and all, then give time. I think sometimes you have to do it over a few visits rather than get everything done in one visit. The rapport has to be built with the patient that okay, I understand what's happening, but help in a particular way when the patient is also ready.
Absolutely. And I think what you mentioned about vitamins is very important. We've also seen a few patients coming in who have severe problems, psychologically and mental health wise speaking. But when we ask them to get a vitamin profile done, we see that there's extreme iron deficiency or vitamin B12 and D is extremely less. So yeah, ruling that out is very, very important.
First rule out medical problems.
Absolutely. Okay, so COVID has hit us all. So post-COVID health anxiety has been a huge topic, and it has increased many folds in people. So what is your experience with it?
It has. COVID anxiety related depression, in fact, the biggest group that has been hit is the elderly population.
Okay.
Because they've missed out on socializing, they've missed out on active time, there is a scare, there is a tremendous fear of going out, and as soon as you try to come out, something happens. So there's a lot of it. A lot of people are actually undergoing brain fog or situations which are not getting them back to their normal levels. But I have a couple of points to make here.
Right.
It was the fraternity, doctors' fraternity, which initially told that we are dealing with something unknown.
Right.
Please protect yourself. No country in this world can manage acute respiratory syndrome in ICU. No one, developed or undeveloped, because it's too high a number. Non-hospitalized patients, most can develop. If COVID is to be there, but people are not getting hospitalized, fine. But hospitalization is very difficult. So, in those days, we didn't know what we were dealing with. And there was hospitalization like rampant and deaths were. That has also created a fear, which now, if you ask me, from November to say October, ever since we have known the latest variant, has been significantly less. Hardly much hospitalization, at least we talk about India. Very few deaths compared to the number of patients that you have.
Right.
It is also our duty as doctors to help patient cope with slightly better time and delete some of the memory that you have built up over a period of time.
Yes.
Get them to accept COVID, get them to test COVID and tell them, look, you have tested, you are fine. I am for testing because the number of times you know you have had COVID, now you know you have hybrid immunity also. Help patient delete some of the memories so that you can live better, come out of that fear. We only have to do it.
Right.
Number two, I do feel there is the role of far too much of information available. I think I'm not for this. This variant has come. It will sometimes organizations saying December is going to be bad or a new variant may be coming. My question is, yes, it may be coming. What am I to do now? Yes, I will not take it lightly, but this fear complex has to go out. Fear, anxiety, depressed mood will impact immunity.
Absolutely.
So I think somewhere we need to stay positive. It is doctor's job also to make them stay positive, make them feel confident that they can deal with it.
Yes.
And when a time comes, which may come, we don't know. Nobody knows in times to come if this becomes more virulent, we may have to face. But let's face it at that time rather than bringing the future today and spoiling what we have today.
Yes. Let's cross the bridge when we have.
Let's cross the bridge. Let's be aware, but not afraid.
Yes. I think that's some really great information. And like you mentioned, testing, which is so important. I think vaccine also played a major role. I'm sure it did give the immunity.
It gave.
And plus the idea that I am vaccinated, I can step out. The confidence was great.
I am vaccinated, I am infected once.
Yes.
I tell them you should have a better confidence. In a way, sometimes in a lighter way, I tell my patients that this is the dawn, you have to pay your dues to the dawn.
Yeah.
If you have paid your dues to the dawn, a few months is not going to touch you.
Right.
3 months, 4 months, 5 months, your immunity is there. Somewhere we need to lighten up because whether COVID will impact in future, I don't know, but it has impacted mental health tremendously.
Absolutely. I think if we put it on a graph, the health anxiety amongst people just went above the roof suddenly. And I think now it has become a little stable, come at a plateau. But it still persists.
It does. And the memory. So recently I had seen one patient who had lost a lot of family members.
Right.
And that hits you.
Right.
And when you listen to that and you understand the patient's anxiety now also, rather than belittling her, why are you anxious now, COVID is not that. The impact that you've lost so many family members, it's not easy. It's not easy to believe that.
You're right. Okay, so let's talk about more specific incidents. So have you ever seen patients coming in with a panic attack, but calling it a heart attack? And how do we go about
Yes,
it?
many times. Many times panic attack with hearing somebody else's news,
Right.
having seen somebody in the family having it, or just plain anxiety and atypical chest pain.
Yes.
And panic attack, when it comes, again, we need to explain, we need to understand, calm it down. Sometimes hold the hand and go through a few tests so that you can demonstrate that there is nothing much.
Mm-hmm.
Sometimes that's not enough
Right.
because the panic comes back. Even if the patients leave your clinic thinking, yeah, I understand, doctor, everything is okay. You go back, you hear something, you look at the great
Yeah.
guru today, Guruji is, I call it Google-ji, and your panic is back.
Right.
Because
Right.
somewhere that fear and your mind will only catch those aspects which feed your fear. So you have to help them with test, with, I also believe you should give medications for symptoms. At least those symptoms can be prevented so you feel better.
Absolutely.
And when the patient is ready, send them for counseling or CBT or whatever helps them.
Must needed, absolutely. I think a lot of people are now aware about, but they still can't make the difference of when it's a panic attack and when it's a heart attack. Yeah. So, have you noticed a pattern of people coming in, showing in poor physical health because of poor mental health? Like they fall sick again and again because they've had a history of bad mental health or something of that sort.
Yes, can't be proven,
Mhm.
but can be, it is more a diagnosis of exclusion when
Mhm.
you've ruled out everything
Mm-hmm.
and then you realize that somebody is down, somebody is depressed,
Mm-hmm.
and somebody has not been doing well mentally,
Right.
coping with a lot of stress. You can assume that yes, that could be causing a dip and ability to fight. I think going into social history, going into what work they are doing,
Right.
also very often situation at home, children, caregivers,
Right.
people who are caregivers. These days you come across so many things, and some of the patients actually, when they come out with it, you also learn. I always say family physician is the best seat in the theater.
Yes.
You feel privileged to be allowed by some patients to look into very personal
Right.
issues. And sometimes when you go through that, patients tear up,
Yeah.
patients will cry.
They
It's
confide
good. I
in
always
you.
encourage good cry. It's all right. At least bring it
Right.
out. And you realize that this must be lot of pent up
Yeah.
feelings, and you allow things to go. Sometimes, and counseling can happen at all levels. Right?
Right.
Your
Right.
first go-to physician can be a simple counselor.
Mhm.
So, in those situations, to explain to them that this could be also the mental part, and exposing them to next level of counseling,
Mhm.
talking about it also helps.
Right, absolutely. I think, like you said, family physician gets the best seat. You are the people who psychoeducate them that probably this is what is happening and this is where you need to go next. So show them the way, which is very, very important for them because they're clueless at that
Yes,
point.
absolutely. And many
Yes.
many don't agree, and rightly
Yes.
so. I always say it is very difficult to do counseling because
Yes.
you are actually. It's easy to be physically naked. It's very difficult to be mentally naked. You come out and
Yeah.
say things which are deep within you, and to tell it to somebody is
Right.
not easy. One of the things I find is also when counseling happens, you talk. When you
Right.
talk,
There's so much to talk about.
lot of clarity comes. Sometimes some knots are there in the brain.
Right.
As my good friend, and I call him my teacher, Dr. Harish Shetty, said, they open up a lot of knots
Yes. Yes.
in the brain, when you talk. So sometimes it's okay not to be told anything, but when you talk, you realize some of the things are very, You talk and you realize clarity comes, and
Right.
then you open up more.
Right. They confide in you, and that's how all of this comes out. Like Dr. Shiva always says that just coming for therapy is halfway.
Yes, I
halfway
agree.
job
I
done.
agree.
So that's a huge step. Let's get into the demographics a little bit. So could you help me with, probably what age group and gender usually you've seen with such problems, and where you see psychological issues stemming into physical ones?
I'm afraid we are seeing even in children in single digit age group.
That's scary.
I would always think that depression would be a middle-age problem or late life depression. Gone are the days.
Yeah.
Teenage depression, I think, is also a very accepted thing. I find a lot of psychological issues even in very, very young people.
Right.
One aspect which it's close to my heart is, as a family doctor, a lot of somatic complaints and a lot of issues come up. We must look for learning disability.
Okay. Yes.
Learning disability could be one of the main reasons for behavioral issues, not doing well, either being very hyperactive or being low on confidence, and very often it is missed. And I feel very pained because very often schools don't pick it up.
Yes.
I'm talking from personal experience, schools don't pick it up. Our attitude has to shift. My attitude shifted to this much later. I would have liked this to be shifted maybe 10 years earlier.
Right.
That, I could pick up a behavioral issue in a child which might be stemming out of frustration. That fish is asked to fly every day.
Yes.
How is that child going to fly? It's a fish, needs water.
Yes.
If the one doesn't know maths, one doesn't know, so be it.
Yes.
Right? And you are judged every single day, and this has, will come out in a family.
Yes.
So you have a lot of missing school,
Yes.
and playing truant, not doing well,
So much of that.
social issues. But then you realize that there are, and parents are not aware, they are earnestly trying.
Yes.
Sometimes I feel teachers are not aware. So, learning, in fact, I remember when I had come to TalkSpace, I had spoken about that with Dr. Shiva, that I would like somewhere the learning disability part, and we discussed that, and she said she's already working on that, have counseling done there for parents, for children, and then remedial, whatever needs to be done, so that the child at least remains kicking and floating till he finds his water.
Absolutely.
And then this child is just going to do extremely well.
Absolutely. I think there are some measures taken for it. It's just that the institutions follow. Every school is supposed to have special educator and a counselor and a proper qualified psychologist. A full-time employee should be there in the school. It's just that so many institutions don't feel the importance.
Yes, and even if they do, sometimes it is missed. I think it's awareness. When as a doctor, I feel that I don't think in my 25 years of practice, I can't say honestly that I was aware all 25 years. I wasn't. I wasn't till it happened much closer to thing, and you realize that you are aware of it, but you don't put it into practice and look for it. What you don't know, you don't look for.
Right.
But once you know, you start thinking, okay, is there a possibility?
Mm-hmm.
Is there a possibility? All children they are not good, they are not bad. All children are similar. They are just children. They are just innocent energies.
Absolutely.
And then you realize over a period of time that somewhere you need to look into this. So awareness is very important, and I guess.
And at all levels.
At all
Teachers,
levels.
parents.
All levels.
All levels.
All levels. Maybe you guys do have a role to play by educating just about LDs.
Yes.
All sorts of.
Okay. Okay, coming towards the end, I just have one last question. What would be your recommendations to people facing such problems, and any recommendations for anything?
My recommendation is go out and express it.
Right.
Don't prejudge it. Don't feel it could be. No, as I tell my patients, don't tell me the reason. Just put out the symptoms that you, however silly you may feel your symptoms are. No symptom is silly. Bring it out. Bring it out. Bring it out. Allow somebody to help. Accept it. Recognize it.
Right.
Once you recognize it, there is a remedy. Psychotherapy, counseling is a much under-tapped
Yes.
light physiotherapy in India.
Absolutely.
These are two things I'm very certain about it, that if these grow from the plant to the tree,
Right.
pill burden will come down in most patients.
Absolutely.
Painkillers will come down, anxiolytics will come down. It is increasing. I'm seeing it grow, but we need to do much more. And health and anxiety related issues are always, you need to dig in a little more.
Yes. Yes.
I am talking about anxiety I'm practicing in a higher socio-economic strata. Can't even imagine what must be happening in the lower socio-economic strata where awareness is not there.
Absolutely.
And acceptance. So we need to really work hard and work fast.
Absolutely. I think even with so much information out there after COVID, probably there's a little bit of awareness, but the acceptance has a way to go, because people think, sab koi ho raha hai, I am part of the crowd, so why go and take help? So
And family.
Yes.
So very often in depression that happens is, family starts denying it because you start feeling guilty that
Yes.
have I done something to my spouse? Have I done something to my parents? And to explain that, and that is a legitimate thinking, but
emotion, yes.
it's legitimate emotion, but you need to counsel that you may not have anything to do with it.
Right, right.
So let's help in whichever way we can.
Yes, awareness and acceptance.
Yes.
Alright, so I think we've come to an end, and these were some extremely insightful views. Thank you so much for your time.
It's an absolute
And,
pleasure.
Yes, let's grow together. Thank you.
Thank you.